So I'd like to thank the ASCO Organizing Committee for giving me the opportunity to talk about therapeutic options in patients with primary refractory or early relapse diffuse large B-cell lymphoma. In this education talk today, we talked about outcomes in patients with primary refractory and early relapse, hence called high-risk diffuse large B-cell lymphoma, with auto transplant, which has been the standard of care for nearly a quarter of a century. We also know that with auto transplant, for these high-risk relapse cohorts, the outcomes are very dismal. As a result, it's really important to move forward beyond an auto transplant. Chimeric antigen receptor T-cell therapies that target CD19 have been FDA approved in the third-line setting, including in patients who have relapsed after an auto transplant. And thus, it was intuitive to move these treatments forward, and in 3 randomized clinical studies, these were pivotal studies which randomized patients with high-risk relapse refractory DLBCL to either standard of care, which included salvage chemo followed by an auto versus CAR T-cell therapy. And 2 of these 3 studies, namely ZUMA-7, exploring axi-cell versus standard of care, and Transform, exploring liso-cel versus standard of care, they demonstrated the primary endpoint of event-free survival was met, demonstrating clear superiority of chimeric antigen receptor therapy, either axi-cell or liso-cel versus standard of care. So for patients who are transplant eligible with primary refractory or early relapse diffuse large B-cell lymphoma, we now consider CD19 targeted CAR T-cell therapy as the new standard of care. The pilot study explored liso-cel in patients who were transplant ineligible with relapsed diffuse large B-cell lymphoma, and in this study, overall response rate was the primary endpoint, and it was met. The overall response rate was 80%, a CR rate of 50%, and the safety profile was extremely manageable. There were no grade 4 or grade 5 CRS or neurological events. Thus, the FDA approved liso-cel for patients who are transplant ineligible in the second-line setting for diffuse large B-cell lymphoma that's relapsed after frontline chemoimmunotherapy, irrespective of the timing of relapse. But we also do know that not all patients are CAR T eligible as a result of access to the center or as a result of the manufacturing times that entail in making the product. And I think in CAR T ineligible patients, we talked about several other options that do exist. For example, there are other CD19 targeted agents such as tafasitamab lenalidomide, loncastuximab, also polatuzumab plus bendamustine rituximab. They have been approved in the third-line setting. Tafa-len has been approved in the second-line setting. I think we also talked about some of the new treatments that have just recently been FDA approved, namely bispecific T-cell engagers targeting CD20, CD3. Epcoritamab gained FDA approval a few weeks ago in the third-line diffuse large B-cell lymphoma setting. So I think overall clinical trials have clearly moved the needle forward in giving us many options for patients with such high-risk relapse refractory disease.